We're talking COVID in Connecticut once again with Dr. Syed Hussien from Trinity Health of New England as we enter, well, the post-July 4th sort of period here. And this is where we're going to start finding out where the latest holiday is going to impact us in terms of cases. I don't know what we're going to expect. Obviously, it seems like the virus, according to the public opinion, is at least at a manageable level now. Do you think we're going to see a bump in cases? Anything that's at least anything more than a blip on the radar?
So if we look at how this virus has behaved and what has happened after 4th of July weekend in 2020 and 2021, there was an increase in cases.
Yeah.
You can now make the argument that we have a large chunk of our population above the age of 5 vaccinated, at least 83% that have received one dose of the vaccine across the country.
Right.
That should help. But on the other hand, playing devil's advocate, the virus has evolved. It is much more contagious, more easily spread, especially the BA4, BA5 variants, which are gaining ground from the Omicron subvariant. So all of that points to a possible increase in cases following 4th of July.
We'll see. I mean, hopefully, given that a lot of these were outdoor events, fireworks and whatnot, it's going to cut down on the spread. Talking more about that, it was last week I was sort of comparing COVID death rates to the flu, and we found that even right now, in a relative lull of cases, COVID is still killing 3 to 5 times more people a day in Connecticut than the flu did in its worst year in the last 12 years. So no comparison there. But it's interesting that sort of life has moved on a little bit. I'm curious to see if you think if COVID is going to continue to get less deadly and start approaching more of the flu, or if that's even really a big worry at this point.
Yeah, as we move towards the endemic stage, that's probably where we're headed, Tim. But the biggest difference I want to remind viewers between the flu and COVID is long COVID. There is no long flu. But up to 30% of people who come down with COVID can be impacted with long COVID, which is a debilitating set of symptoms that can impact the heart, the kidneys, the lungs, liver, brain, a lot of different organ systems.
Yeah, it's different in every person that we're talking to. And we still don't, I feel like, have great data on how many of these long COVID cases eventually resolve at all, or whether they're just ongoing forever. That's something we're going to have to monitor in the coming weeks and months. Where do we stand with vaccine technology? I know we're still looking to try to find new nasal sprays, new ways of trying to stay one step ahead.
Sure, absolutely. So we reached a milestone in the last couple of weeks with age 6 months to 5 years now eligible for the vaccine. We do expect Pfizer and Moderna to submit additional vaccine formulations that will cover Omicron for the fall.
Yeah.
That's where we're at right now, Tim. But if you are one of those individuals that are due for a booster, please don't wait for the fall rollout. Now is the time to get that booster shot.
Yeah, anything is better than nothing. I know I wanted to ask you, just talking about non-COVID things, it's a little too early to figure out exactly how busy the emergency departments were over 4th of July weekend. You need that debrief. I'm just curious, can you talk a little bit more about what goes into staffing levels when you know there's a holiday weekend, when there could be more fireworks-related injuries, drunk driving-related injuries, things like that? Is there anything special you do other than adding more staff, or is it just you guys have done this before and you'll do it again?
Yeah, we look at historical data as to which timings, for instance, of the day our EDs are busiest, how we need to staff, and we staff accordingly, knowing fully well that people also want to take some much-needed time off. Our healthcare workers, our heroes, have been through so much over the last 2 years.
They really have.
So it's important to keep that in mind, but we look at historical data in order to plan for staffing.
Yeah, and we will probably get those numbers, and maybe we can talk about them next week when we have you back again, because you're always so good with your time, joining us every Tuesday morning, even coming off the long holiday weekend. We appreciate it.
Thank you. Thanks
good
for
to see
having
you again.
me.
Dr. Syed Hussien from Trinity Health of New England. Okay, over to Matt Scott now to talk about the forecast.
Right. Before we get to that, Mr. Lambers,
Yes,
please
sir.
send my best to Dr. Hussien in how well he did in the Nathan's 4th of July hot dog eating contest. We were rooting him on in the Scott household.
I won't even tell you what he said, because it's a non sequitur that made no sense whatsoever. Not going to work.
Now. Yeah, he'll
couldn't hear you.
He'll see it later on, and we'll all have a good chuckle. All right, let's get to